हेलो दीदी, कैसे हो आप?
अच्छे हैं। तुम कैसे हो?
मैं भी बढ़िया। नमस्ते
नमस्ते
मैम।
मैम।
Namaste. Good evening. How are you both?
आई एम गुड मैम। हाउ आर यू?
आई एम ऑल्सो गुड
All
मैम।
well. Thank you.
नमस्ते
नमस्ते
सर।
सर। नमस्ते। नमस्ते। या।
सो गुड इवनिंग टू एवरीवन। This is episode 13, How to Learn to Understand Ayurveda. Myself, Sangeeta Singh from Bhopal and Anurag from Dehradun. We both welcome our guest speaker, Dr. Rajkumar sir and Dr. Ramya Krishnan ma'am. Dr. Rajkumar sir, Associate Professor of Roganidana Department and HOD of Roganidana Department, Government of Puducherry, Mahi. Pioneer of SPPA, Dr. Ramakrishnan ma'am, pioneer of SPPA, associate professor in Dravaguna department and HOD in Dravaguna department, government of Puducherry, Mahi. We both welcome you in this Panchakarma exclusive episode. uh, so, this is episode 13 of Panchakarma exclusive. Before going to all the questions, I would just like to discuss few things about Panchakarma with Anurag. So before starting any discussion, also Anurag with you, I would just like to share my experience. What was my experience during my final year. So, Panchakarma was introduced in from first year itself. And Panchakarma was hyped since first year itself in Ashtang Hridaya, in second year also in Charak we studied, in third year in Siddhistan. In final year, it was on a separate subject. So every year we have studied Panchakarma, no doubt. So whenever Panchakarma was hyped with that Panchakarma remove all the doshas, then disease do not come back like that. All the theories, whatever used to be mentioned, जो भी हमें पढ़ाया जाता था थ्योरी में, वो सारी चीजें पंचकर्मा से रिलेटेड एवरीथिंग, ये चिकित्सा है, ये पंचकर्मा, ये चिकित्सा, ये पंचकर्मा, जो भी बुक में भी लिखा रहता था वो भी पढ़ाया जाता था, थ्योरी एज इट इज भी पढ़ाई जाती थी. बट व्हेन इट कम्स टू ओपीडी लेवल, जब मेरी ओपीडी लेवल पे पोस्टिंग लगने लगी, जब हमने देखने लगे, सो इट वाज क्वाइट अ डिफरेंट सिनेरियो व्हाट वाज लाइक जो हमें पढ़ाया जा रहा था और जो हमें ओपीडी लेवल पे देखने को मिल रहा था was completely different. Like जैसे हमें बोला जाता था कि हम 7 दिन तक दीपन पाचन देते हैं, बट स्टार्टिंग से ही पेशेंट आया, दीपन पाचन भी दे रहे हैं और फिर अभ्यंग स्वेदन भी कर रहे हैं और बस्ती भी दे रहे हैं. सो दिस वाज ऑल यूज्ड टू बी हैपन. सो थ्रू आउट दैट हमने तो यही देखा है अपने पंचकर्मा डिपार्टमेंट में. सो व्हाट वाज योर एक्सपीरियंस, लाइक यू आर इन फाइनल ईयर अनुराग, तो तुम्हारा क्या एक्सपीरियंस अभी चल रहा है पंचकर्मा में?
जब फर्स्ट ईयर था तो तब से जैसे आपने बताया कि पंचकर्म ही हर जगह पढ़ने को मिल रहा था, अष्टांग में और बाकी सब जगहों पे भी। तो ये सबके साथ ही सीन सेम है, मेरे साथ भी यही था। और अभी जैसे जैसे आगे बढ़ते रह रहे हैं, फाइनल ईयर में हूँ मैं अभी। तो जितना भी मैंने अपने कॉलेज में देखा यहाँ पे कि ओपीडी लेवल जब बात की जाती है तो मैक्सिमम केसेस पंचकर्म में ही शिफ्ट कर दिए जाते थे। तो शुरुआत में मुझे लगता था कि पंचकर्म ही आयुर्वेद है, कि मतलब यही होता ही है आयुर्वेद में। तो उतनी कोई क्लियरिटी थी नहीं कि एक आयुर्वेद में पंचकर्म आता है। मुझको लगता था कि पंचकर्म ही आयुर्वेद है। तो वहां पे काफी ज्यादा वेरिएशन देखने को मिलते थे, और ओपीडी लेवल पे ही चीजें बहुत अलग अलग हो जाती थी। कि अगर क्रॉनिक केस आया है ओपीडी में तो वो डेफिनेटली पंचकर्म में ही जाएगा, और ये जा भी रहा है। और जैसे आपने बताया कि ऑन टाइम की 1 हफ्ते तक हमको दीपन पाचन करने का अगर निर्देश है, लेकिन यहाँ पे पेशेंट की अवेबिलिटी के हिसाब से होता है। देख रहा हूं मैं कि पेशेंट अगर 1 हफ्ते के लिए, तो उसी 1 हफ्ते में दीपन भी कर दिया, पाचन भी हो रहा है। तो ऐसा रह रहा है सीन पंचकर्म में। बाकी तो सब सेम ही है मैक्सिमम जगहों पे।
ओके। सो लाइक तुम्हें क्या लगता है कि लाइक पंचकर्मा इतना ओवर हाइप क्यों है, लाइक या पंचकर्मा क्यों ऐसा है?
एक्चुअली जो मुझे लगता है कि पंचकर्म में यहाँ पे जैसे बच्चों का भी ड्रीम होता है, जितने भी हम स्कॉलर्स मैक्सिमम का ड्रीम है कि अपना एक पंचकर्म का क्लिनिक होगा, अपना एक पंचकर्म का एक सेंटर होगा। तो वहां पे उनको इकोनॉमिकल स्टेबिलिटी दिखती है, जो कि है भी। आप अननेसेसरी भी चार्ज कर सकते हो। एक प्रोसीजर का 10-12 हजार, 15 हजार, कहीं कहीं 20-20 हजार चार्ज हो रहे हैं। तो पंचकर्म क्लिनिक से आप महीने का आराम से 1-1.5 लाख रुपए तो कहीं नहीं जा रहे। लेकिन वहीं पे अगर आप ओपीडी पे अपनी क्लिनिक पे आप जनरल प्रैक्टिस करते हो रादर देन पंचकर्म, तो हार्डली आप 25-30 हजार ही अर्न कर पाओगे। तो मुझको तो सबसे बड़ा फैक्टर यही लगता है कि पंचकर्म में लोग क्यों जाना चाहते हैं, कि वहाँ पैसा बहुत है।
राइट। कि जो लाइक लाइक जो डिनोमिनेटर फैक्टर है पंचकर्मा में वो मनी है। एग्जैक्टली दैट यू कैन अर्न अनलिमिटेड मनी विथ पंचकर्मा, और बाय डूइंग वेदर इट इज राइट और रॉन्ग, वी डोंट नो व्हाट इज हैपनिंग इनसाइड द हॉस्पिटल्स।
हम्म।
So and obviously when you are doing with only with medicine, obviously you are limited with some financially extent. So okay.
एंड
Yeah.
माय क्वेश्चन इज, अभी जो अभी चल रहा है आज के सिनेरियो में कि पंचकर्म के ट्रेनिंग प्रोग्राम चल रहे हैं, 6-6 महीने के ट्रेनिंग प्रोग्राम से सर्टिफिकेट दिए जा रहे हैं उसमें। और उसको बीएमएस डॉक्टर्स भी अटेंड कर रहे हैं, स्टूडेंट्स भी अटेंड कर रहे हैं, और इवन फॉरेनर्स भी अटेंड कर रहे हैं। और वो 6 महीने में सर्टिफिकेट लेके अपने अपनी जगह पे पंचकर्म वो परफॉर्म भी कर रहे हैं। तो अंतर क्या है कि हम
So
5.5 साल तक पढ़ रहे हैं चीजों को, और वो 6 महीने में कैसे एक्सपर्ट हो जा रहे हैं चीजों में। तो इसमें अंतर क्या है?
एग्जैक्टली, एग्जैक्टली आई हैव द सेम डाउट कि जब हमें लाइक हम 5.5 साल तक, हम तो चारों साल पंचकर्मा पढ़ रहे हैं इन एवरी संहिता और समथिंग लाइक दैट। और फिर उसके बाद एडिशनली बीएमएस स्टूडेंट भी जाता है 6 महीने का कोर्स करने, नेचुरोपैथी में भी 6 महीने का पंचकर्मा का कोर्स होता है। एंड उनको बिल्कुल उतना डीपली आइडिया नहीं होता है कि वेयर वी कैन एडमिनिस्ट्रेट दिस पंचकर्मा। और हम फॉरेनर्स को भी सिखा रहे हैं, फॉरेनर्स को तो बहुत ही बेसिक चीजें भी उनको नहीं पता रहती है। सो वी आई डोंट नो व्हाट वी आर क्लियर कटली, यहाँ पे तो मार्केटिंग ही दिख रहा है। बट वी विल जस्ट हम अपने पॉइनियर से भी पूछेंगे कि इस बारे में उनकी क्या राय है आगे चल के क्वेश्चंस में। बट लेट्स सी हमारे ऑडियंस का भी क्या इस पे जवाब है कि ये जो कोर्सेज चलते रहते हैं, आपका क्या ओपिनियन है, आप इस पे क्या कहना चाहते हैं, आप अपने कमेंट सेक्शन में जरूर बता सकते हैं। सो ऑब्वियसली अनुराग, लाइक ये जो मार्केटिंग और एडवर्टीजमेंट हो रही है उस पे तुम्हारा क्या कहना है पंचकर्मा पे,
एक्चुअली
गवर्नमेंट
मैं
की तरफ से एवरीथिंग?
एवरीथिंग तो अभी मैं देहरादून में ही रह रहा हूँ, ऋषिकेश बहुत दूर नहीं है यहाँ से। तो
या
ऋषिकेश और ये क्या कहते हैं हिमाचल, जितने भी टूरिस्ट स्पॉट हैं ये सब ना पंचकर्म का हब बन चुके हैं। तो यहाँ पे गवर्नमेंट खुद प्रमोट कर रही है, पेशेंट्स पोर्टल पे रजिस्टर करते हैं, और उनको ऑन फोन कॉल ही पूर्व कर्म बता दिए जाते हैं कि आप 1 हफ्ते पहले ये चीज करके आओ। और सीधे वो ऋषिकेश में लैंड होते हैं, पंचकर्म उनका होता है, वो घर जाके अपना संचंदन कर्म करते हैं। तो यहाँ पे गवर्नमेंट भी एडवर्टाइज कर रही है पंचकर्म को एकदम सीधा सीधा कि पंचकर्म ही सब कुछ है, और सबसे ज्यादा अर्निंग भी गवर्नमेंट को इसी से ही आ रही है, पंचकर्म से ही आ रही है। तो यहाँ पे एडवर्टीजमेंट और मार्केटिंग ये एक्सप्लॉइट कर रहा है आयुर्वेद को एक बहुत गलत तरीके से। और पेशेंट्स को भी कहीं ना कहीं एक्सप्लॉइट कर रहा है, पेशेंट्स अनजाने में वो भरोसा करके आ रहे हैं। और पूर्व कर्म और पश्चात कर्म दोनों अपने हिसाब से देख लें, और जो प्रधान कर्म है पंचकर्म का वो आके यहाँ पे फॉलो करवा लें। तो ये मार्केटिंग एंड एडवर्टीजमेंट में चल रहा है, और गवर्नमेंट भी इसमें रोल प्ले कर रही है बहुत ज्यादा।
Exactly. Even being Kerala being a tourist spot, so we know कि टूरिस्ट मनी हमारे पास कितनी इम्पोर्टेंस रखती है और टूरिज्म से
हम्म,
हम कितना ज्यादा अर्न करते हैं। तो टूरिज्म के लिए लाइक टूरिज्म पैक करके पंचकर्मा पैक है जहाँ पे केरलीय पंचकर्म, कर्कटा थेरेपी, ऐसे बहुत सारी
हाँ,
चीजें हैं जो केरला में भी देखने को भी मिलती है। इवन नॉट ओनली नॉर्थ, साउथ में भी ये चीज देखने को मिल रही है। मतलब जहाँ पे लाइक केरलीय पंचकर्मा में ये बोला जाता है कि लाइक कोई साइड इफेक्ट्स नहीं है, और लाइक एक तरह से यहाँ पे पूर्व कर्म को ही प्रधान कर्म में रखा जा रहा है और दीपन पाचन को पूर्व कर्म में रखा जा रहा है। मेनली ब्रह्मी और कर्म के लिए ही इसे यूज किया जाता है। एक सिंबॉलिक पंचकर्मा दे दिया गया है, बट उसमें एज सच पंचकर्मा जो 5 बोले गए हैं एग्जैक्टली वो चीजें नहीं होती है वहां पे। सो आई डोंट नो व्हाई दे आर कॉलिंग पंचकर्मा देन। ऑल्सो कर्कटा थेरेपी जो मॉनसून थेरेपी जिसे बोला जाता है, जहाँ पे स्पेशल टाइप ऑफ कांजी पिलाई जाती है
हम्म,
इररिस्पेक्टिव ऑफ पेशेंट का स्टेट और स्टेज क्या है। और बोला जाता है कि लाइक बहुत सारे जो 14 डेज तक हर दिन 60-60 मिनट जो प्रोसीजर होते हैं, इट इज सेम, इट इज फिक्स्ड, इट इज पैकेज। सो आई डोंट नो वेदर दिस इज राइट और रॉन्ग, वी विल नो कि हमारे पॉइनियर्स का इस पे क्या कहना है। लेट्स सी। ऑल्सो अनुराग, जब हम बोलते हैं कि पंचकर्मा दोष रिमूवल है, तो लाइक अगर दोष रिमूव ही हो जा रहे हैं, सो लाइक फिर बॉडी चल कैसे रही है? क्योंकि हमें, हमारा तो ये श्लोक है ना कि दोष धातु मल मूलम सदा देहस्य। तो अगर दोष रिमूव हो जा रहे हैं तो फिर बॉडी रन कैसे कर रही है? क्या तुम्हारे दिमाग में भी ये
यही
क्वेश्चन आता है?
यही यही सबसे बड़ा क्वेश्चन अभी तक मेरे दिमाग में यही है कि जैसे दोष धातु मल मूलम की शरीरम बोलते हैं पंचकर्म में, फिर एक ये भी आता है कि दोषों का निर्हरण कर देते हैं। तो जब दोषों का निर्हरण कर दिया तो फिर बॉडी गवर्न कैसे हो रही है? क्योंकि ये भी देखते हैं हम कि पित्त पंगु कफ पंगु, ये श्लोक भी आता है कि वात ही चला रहा है। जब हमने दोषों का निर्हरण कर दिया तो बॉडी वहां पे कैसे परफॉर्म कर रही है, ये सवाल मेरे अंदर भी है। और काफी लंबे समय से था, लेकिन अभी तक जवाब नहीं मिल पाया है इसका मुझे, कि हो क्यों रहा है ऐसा। अभी आज के
हाँ,
सेशन में क्या पता हमें जवाब मिले इसका, क्वेश्चंस में,
मे बी।
लेकिन क्यों हो रहा है मुझे नहीं पता।
और मे बी हमारे पंचकर्मा टीचर ने तो आज तक बताया नहीं, एंड इट इज नॉट अ स्टडी क्लास कि यहाँ पे पॉइनियर्स भी बताएं इस चीज को। बट
हाँ,
या विल सी, लाइक एटलीस्ट एक फ्रेमवर्क तो जरूर मिलेगा अकॉर्डिंग टू अवर सेशन टाइटल की हाउ टू लर्न टू अंडरस्टैंड आयुर्वेदा। सो ऑल्सो दैट क्रॉनिसिटी इज इक्वल टू बहुदोष अवस्था। अगर
हाँ,
10 साल से हाइपरटेंशन है, डायबिटीज है, तो वो बहुदोष अवस्था में देखा जाता है इर्रिस्पेक्टिव ऑफ रोग रोगी परीक्षा। सो आई गेस मुझे तो ऐसे ही पढ़ाया गया है। आई डोंट नो अबाउट यू, व्हाट इज योर पॉइंट?
नहीं एक्चुअली मुझको लग रहा है ना हर जगह यही है, मेरे यहाँ भी ऐसा ही सीन है कि अगर कोई पेशेंट 10 साल 20 साल या फिर 5 साल से भी ऊपर का एक डिजीज को होल्ड कर रहा है, तो वो यहाँ पे आते ही सबसे पहले काम होता है कि रेफर किया जाता है पंचकर्म में, कि आप पंचकर्म में जाइए, वहां पे जो प्रोसीजर होंगे उसके बाद पंचकर्म के प्रोसीजर होते हैं, और उसको क्रोनिसिटी इक्वल टू बहुदोषावस्था ही यहाँ पे काउंटर की जा रही है। और उसी अकॉर्डिंग पंचकर्म को सीधा जो है सेलेक्ट किया जा रहा है मैक्सिमम जगहों पे।
राइट। एंड ऑल्सो द वेरियस काइंड ऑफ बस्ती, सिरोधारा, देन सद्यो वमन, मृदु विरेचन, ये सारी चीजें जो हमें देखने को मिल रही है इर्रिस्पेक्टिव ऑफ स्टेट एंड स्टेज। हम देख रहे हैं कि बस्ती, सिरोधारा तो सबके लिए हो गई है, ठीक है।
हम्म,
बस्ती भी आप आए हो खाली पेट तो ले लो भाई, बस्ती ले लो। सो एंड सद्यो वमन विरेचन, यू नो अबाउट दैट,
हम्म।
राइट? कि कैसे एडवर्टाइज किया जा रहा है। क्या पॉइंट, क्या कहना चाहोगे इस पे?
एक्चुअली यहाँ पे क्या है ना कि जैसे बस्ती है और विरेचन है, और यहाँ तक कि निरु बस्ती शिरोधारा, इन सब ये सब प्रोसीजर को परफॉर्म करने में उतने कॉम्प्लिकेशंस पेशेंट्स में देखने को नहीं मिलते हैं, इसलिए इजीली कर भी दिए जाते हैं। लेकिन वहीं पे अगर हम बात करें वमन की, तो वमन करवाने बहुत ही हैवी टास्क है पेशेंट्स को। वहां पे पेशेंट्स कई बार हाइपोवॉल्मिक शॉक और एनालिटिक शॉक में पेशेंट्स चला जाता है, फिर वहां पे फिर उनको आगे भेजा जाता है इमरजेंसी में, और मॉडर्न नहीं भेजा जाता है कि आप संभाल लो इसे। तो जो चीजें
right.
इजली प्रोसीजर है तो उनको तो मार्केट में अच्छे चल रहे हैं, जो कॉम्प्लिकेटेड है तो उनसे लोग बच रहे हैं, उनको नहीं करना हमें।
Yeah.
क्योंकि पंचकर्म इट्सेल्फ खुद में ही बहुत हेक्टिक और बहुत ही कॉम्प्लिकेटेड है, ये लोगों को परफॉर्म करवाना, कन्विंस करना।
Yeah. क्योंकि लाइक अभी जैसे कि मृदु विरेचन करा लो, आप हर महीने करा लो, कोई दिक्कत नहीं है, गट क्लीन हो जाता है। इवन दो वेदर इट इज रिक्वायर्ड और नॉट रिक्वायर्ड, आई
हाँ।
डोंट नो। क्योंकि अगर अगर आपने एक ये जर्नलाइज स्टेटमेंट दे दिया, किसी ने अपने रील में किसी ने जर्नलाइज स्टेटमेंट दे दिया और वो उसको मैक्सिमम लेमैन फॉलो कर रहा है, उसे तो नहीं पता है, वो तो जाके कंसल्ट नहीं करेगा क्योंकि आपने रील बना दी। तो बहुत सारी ऐसी चीजें हैं, जैसे डेली अनु तेल का नस्से ड्रॉप लेना, बहुत सारी ऐसी चीजें हैं जो कि रील्स के माध्यम से प्रोपोगेट की जाती हैं। और फिर हमें तो जब वो एक लेमैन तक पहुंचती है, आई डोंट नो वो कैसे उसे लेते हैं, वेदर दे नो द कॉन्ट्राइंडिकेशन और इंडिकेशन। सो ऑब्वियसली जो है कि देर नीड सम स्टैंडर्ड प्रोटोकॉल्स फॉर ऑल दोज थिंग्स। So this was our very small discussion about all the questions we had. We did not any answered any question. We just had so many questions, so many doubts. So, sir and ma'am, should we start with our questions? Yeah. So my first question is, why are the pharmacodynamics and kinetics of Panchakarma procedure and Purva Karma not there in curriculum?
Namaste, good evening. Actually, that question is very relevant question. Nowadays, I was just going through the curriculum of Panchakarma and I didn't see this part. Actually, whenever any karma is being taught, it is karma means whichever upakrama. Upakrama means there are two types of upakramas, mainly langhana and brahmana. So in langhana, under langhana, shodhana and shamana comes. So whichever karma is taught, definitely all the BAMS students are intended to become physicians. So they should be knowing the scientific background of every upakrama. So Vamana, Virechana, etc. Vamana and Virechana are technically placed under a common term called Virechana. As you know, Charaka has mentioned Virechana, common term for Vamana and Virechana. And how is this Vamana Dravyas and Virechana Dravyas are working in the body? That is mentioned by a shloka in Charaka. My question to you is whether it is educated in Panchakarma classes, theory classes, how that is working. I think you are muted, Sangeet.
Sorry, ma'am. Uh, how, like, mode of administration, like mode of action, there is a topic, like how the mode of action it is working, the shloka which is mentioned, but it is not, just an Hindi अनुवाद जैसे समझा दिया जाता है, वैसे ही it has been explained theoretically.
Okay.
That's it. Yeah.
Okay. So it is to be understood. Most of the time we think that the Adhishtana of Vamana Dravya is Amasya and Adhishtana of Virechana Dravya is Pakvasya. But the thing is that Acharya told very specifically Tatroshna, Tikshna, Sukshma, Vyavai, Vikashini, Aushadhani, Swaviryena Hridayam Upetya. धमनीरनुसृत्य स्थूलाणुस्रोतेभ्यो शरीरं गदं दोषसङ्घातम् आग्नेयत्वात् विष्यन्देति तैक्ष्ण्यात् विच्छिन्दयति. So in Vamana and Virechana, all the Vamana Dravyas and Virechana Dravyas are having these properties: Ikshna, Ushna, Ruksha, Sukshma, Vyavai, Vikashi. Then only that Chedana action will happen. Hridayam upetya. So first of all, when a patient is taking Vamana Dravya or Virechana Dravya, the adhikarana of these dravyas are not Amasya or Pakvasya. The main adhikarana is Rasadhadu. Rasadhadu Moolasthana. Is it not? Rasavaha Srotas Moolasthana is Hridaya and Dashadhamanis. So Hridayam Upetya Stula Anu Srodebhyo. So we know that there are Dhamanis, Dashavida Dhamanis, Sharira Gadam. So it is spreading all over the body. Vamana and Virechana Dravyas. But even though they are consumed through mouth or they are reaching in every part of the body, Stula Anusrodebhyo Shariragadam Dosha Sanghadam Agnetvad Vishyandedi Taikshnyat Vichindedi. So by Agneya property, yasya Shodhane Shakti Satikshna. So Shodhana Dravyas are having Tikshna Guna. So by that property, Tikshna Guna, Chedana is happening. Agnetvad Vishyandedi and Taikshnyat Vichindedi. Vichindedi means forceful expulsion of doshas are happening. Why I told this? Because there is a shloka in Rasa Vaisheshika. Okay. Tasmin pradushte with reference to Rasa Dhadu. Tasmin pradushte sarva dhadu pradosha. Tasmin vishuddhe sarva dhadu vishuddhe. When Rasa Dushti is happening, it can cause dhadu pradosha. All other dhadus can go vitiated. And tasmin vishuddhe, if rasa vishuddhi is happening, it will cause, naturally, it will facilitate shuddhi in other dhadus. So when you are administering vamana and virechana in wrong conditions, sarvam, all the upakramas are intended to be done in its own intended conditions. Kala is very important. So if it is administering in wrong conditions, it can cause rasa avishuddhi or rasadushti, and it can cause other dhadu pradoshaja vikaras also sooner or later. So the action, primary action is in Rasavaha Srotas Moolasthana, Hridaya and Dashadhamanis. So that brings out the importance of doing, scientifically rendering these therapies, Vamana and Virechana. So it is theoretically as well as practically very important shloka. Unfortunately, that seriousness is not there. I think it is not conveyed how it is working. Even otherwise also, when we are observing procedures, we are not intended to become technicians. We are intended to become doctors. So we have that liability to explain to people how what is happening after they consume Vamana Dravya, Virechana Dravya, etc. So that part is important. That's all. It is to be done in syllabus, included.
The most important thing in this is the gunas of these dravyas are vada prakopi, or which can vitiate vata. So you have to be very careful. Not only that, it is vada prakopi, it will be affecting hridaya also, so which is a marmasthana. So these are very serious procedures which are to be done under direct observation, as well as so much carefulness is required. So to realize that this is to be included, essentially included in the syllabus. Both are very important. That's all.
For next
Thank you,
question,
sir. Thank you, ma'am. Yeah, next question.
sir, our question is from pending question of Kumar Bhritya. The question is relevance of Panchakarma in children and also relevance of Panchakarma in all age patients of all kind.
Children, Kumara or Bala, it's very weak. Their dhadus are not developed. Ojas is not fully developed. Once child reaches the age of 17 or 18, then only he can be considered. After 16 years, Shodasha Varsham Balam. So till then, dhadus are very weak, and any sort of these procedures can so all the medicines should be very mild, and other things are explained in the science itself. Only thing that could be done is Vamana. So that Vamana, we need not give Vamana medicine and do it. It will automatically happen if dosha utklesha is there and just by initiating that process. So other than that, no Panchakarma procedures are required, as well as only Kapha Vritti and Agni Madhya are possible in children or in Bala. The most proneness for Kapha Vritti as well as Agni Madhya are prone in children. So all the Panchakarma procedures are very much exhaustive, or it causes so much Tikshna Guna, Ushna Guna, etc. will cause so much interference in the development of thalmus of children. So it's not only wrong; it can cause so much damage to the tissues of the body in the children. So blind application of these Panchakarma procedures can be very dangerous. Also, it can result in fatality also. But people think that Ayurveda is safe. Ayurveda procedures are safe. So these complaints are not coming up, but it's very dangerous. Even this Sneha Sveda, extreme heat application, most of the procedures are contraindicated. And in emergency condition also, they should not be applied this sort of Sneha Sveda because their sadhus are not at all developed. So, Panchakarma is not applicable for children. Shamana methods are to be incorporated. And if Vamana is to be done also, that should be in a very mild form. And such conditions are not there at present. And most of the diseases are of some other origin that we will explain or we will discuss in the coming questions.
Sir, also someone has written that Matra Vasti is given to below 10-year-old kid.
Actually, regarding children, I have certain points with special reference to Kashyapa Samhita. Acharya Kashyapa told very specifically, Balina Sthira Dehasya Tasya Samshodhanam Hidam. Balina Sthira Dehasya. Children are having Asambhurna Dhadu. They are not having Sthira Dehatva. So that itself makes clear indication that children are not in general intended for Shodhana Karma. And also another interesting context of Kashyapa Samhita where Acharya told how to do Shamana in an interesting manner, like which all patients are not intended for Shodhana. He didn't tell it directly, but he told indirectly which all kind of patients are not intended for Shodhana. We know that children belong to such a category where Shodhana is not intended. The shloka is like this: Deeptagneha karma nitya, ye nara yuksha bhojinaha. So those who are having Deeptagni, if children are not having Deeptagni, definitely Shodhana is not the way. Agni Deepana is the method. Karma Nitya, always engaging in physical activity. Ye nara ruksha bhojanaha. Children are always not generally intended for ruksha bhojana, but abhishyandi bhojana can cause harm, hazards in children. Madhurya snigdha shidani laghuni cha hidani cha ojasam vardhanani ahu tasmad balam tadhashi. But still, they in disease condition or proneness to disease condition, ruksha bhojana will be desirable. Viruddha adhyashana jeerna do viruddha adhyashana ajirna doshan abhisahanti. Those people who are able to tolerate viruddha adhyashana ajirna, how they can tolerate? By vyayama snigdha deepta agne vayastha balashalina. All these methods are advised. Swastha vrto na te shodhya rakshya vata vikarata. Swastha na te shodhya. Very specific advice by Acharya Kashyapa. In Swastha status also, don't do Shodhana. Rakshya Vata Vikarada. If people are having Deeptagni, they are constantly engaged in karmas. Viruddha Adhyashana Ajirna, they are able to tolerate all this and they are practicing general Swastha Charya. They are not intended to do Shodhana. And Shamana has got very good importance in children, which is highlighted by Kashyapa. Dosha Shantaucha Dhadunam Prasadam Upajayade. There is no need to do Virechana to produce Dhadu Prasada in children. Dosha Shantaucha Dhadunam Prasadam Upajayade Malayananam Sarvesham Avyaghada Kriyasucha. Dosha Dhadu Malis Tasmat Swe Swe Karmani Avasthide. Swastham Ulpadyade Narnam Aswastham Tat Vibhade. So Shamana is the best technique for children because all these whatever Malayananam Sarvesham Avyaghada Kriya Dosha Dhadu Sama Karmas and Swasthya is resulting by Shamana. And most importantly, Asambhurna Dhadu and Asthira Dhadu, Asthira Sharira, and their ojas is also fully developed. So this, owing to these reasons, children are not in general intended for any Shodhana karma. And considering disease, we cannot treat because we have always Hetu Viparita treatment is advocated. Tasya tasya shamam kuryat. Na to vyadhi viparye. Arogya Raksha Kalpadruma. Children, a book which is of very high value in pediatrics. Tasya tasya shamam kuryat na to vyadhi viparye. Vyadhi viparye treatment should not be given. Always we have to consider Hetu only. So all the conditions, Hetu Viparita Chikitsa can be best adopted by Shamana strategies. So Shamana itself is intended in children. Nowadays, autism and all, I'm finding in practice also, autism and other ADHD, etc. So much of Panchakarma procedures are done. Purva Karma procedures are also done and costing very huge amount for the parents. They are telling 1 to 2 lakhs being spent in an Ayurveda hospital, and child got very much worsened after that. Leaky gut syndrome will be aggravated. The child's Agni will be completely vitiated. I am directly seeing such children in my practice. So it is very undesirable to do like that. That's my opinion.
Moreover, Sangeeta asked one question that Matra Vasti could be done or not. Matra Vasti is not Shodhana Vasti, and children are less prone to develop Vedic diseases. And Matra Vasti, as such, is not needed because internally itself we can do that Anlomana Karma. And Sama Dosha Dhattvagni Samadam can be achieved by internally modifying the Vedic aggravated or pick factors. So it is not like always we need to do some procedure from outside to maintain the homeostasis. So dosha dhattvagni samadam sampraptim visheshu cha kriyanam anulomyam cha karoti akupito anilaha. So maintain vata in its normal state itself is samadosha samadhadu and samamalakriya will be achieved. So Matravasti is not a Shodhana Chikitsa and children are not prone to Vedic diseases.
Thank you, sir. Thank you, ma'am.
Thank
I
you,
think
sir. Thank you, ma'am.
दीदी
Yeah. Am
आपको
I audible?
भी दिया है sir? हाँ ऑडिबल, लेकिन आपका ऑडियो नहीं चल रहा है. अरे वीडियो नहीं आ रहा
Audio.
आपका.
Oh,
ऑडियो क्लियर बट वीडियो नहीं आ रहा आपका.
now?
ना इट्स
Okay.
बस
Okay,
गोल
leave
घूम
it.
रहे.
Yeah. Why a uniform pattern of prefixed package of Kriya Karma are adopted in patient with same disease identified? What is the logic of prefixing of Kriya Karma?
Actually, this Dvividha Upakrama, first of all, students must understand that Ayurveda is not equal to Panchakarma. Ayurveda Dvividha Upakramaniyam is highlighted, Langhana and Brahmana. And Acharya Ashtanga Sangraha, Sutrasthana, 21st chapter, very important chapter, Dosha Upakramaniya. In that, there is one important shloka. Vitnyaya karma bhi svai svai doshodregam yadha balam. Bheshajam yoje tat tat tandri kurya na tu kramam. So what does that mean? Vitnyaya karma bhi svai svai doshodrege yadha balam. Which dosha is aggravated there? and what is the strength of dosha and the patient. Both. Both are to be estimated, and bheshajam yoje tat tat. Accordingly, you have to integrate bheshaja. Bheshaja means treatment principle. Treatment principle is to be decided after knowing the strength of dosha and also the sway doshodrige bela of the patient. Tandri kurya natu kramam. Don't follow text as such. Don't follow text as such. Tandri kurya natu kramam. In the same order. What is mentioned in the text, don't follow like that. So what is to be intended? When a patient comes, what is first to be estimated is itself. Like in Panchakarma department, I don't know why there is a need of a separate department which is meant to do Panchakarma only. It should come under Kaya Chikitsa, because wherever Panchakarma is intended, only Panchakarma needs to be done. So there should be, if a patient is directly referred to Panchakarma, he is doing Panchakarma only, means that is analytical reductionism in Ayurveda. Nahi jnana aveva is being, what you call, you are not getting a holistic aspect of the patient, and you are not able to intervene upon the patient holistically. So the thing is that first, what is to be appraised is whether Langhana or Brumhana is intended. And if Langhana is intended, we know that Langhana indications, Mehama dosham adhisnigdha, Jvaroru stamba kushina, Visarpa vidradi pliha, Shirakandhakshiroginam, Stulamsha Langhe nityam Shishiretu abaranabi. So we understand that Langhana is intended in these conditions. Next, what comes? Whether Langhana is to be done by Samshodhana, or Langhana is to be done by Deepana and Pajana, or Langhana is to be done by Shutrishna Nigraha. Again, sub-classification is happening. Like this systematic way of training, Tatra Samshodhane, Staulya Bala Pitta Kabhadigan, Amadosha. So first, where Samshodhana is intended, Tatra Samshodhane, Staulya Bala Pitta Kabhadigan. In stula conditions, when dosha bala is more and patient strength is more, there only samshodhana needs to be considered. Otherwise, same Langhana indications with madhya dosha bala. What is to be done is mentioned. Ama dosha jarat sardi adhisara hridamayan vibandha gauravodgara krilasadibiradhuran madhya staulyadigan purvam pajana deepanehi. Madhyastaulyadigan Purvam Pajana Dipanahi. So students are to be enlightened. See, this is intended for Langhana by Shodhana, Langhana by Pajana Dipana, and Hina Staulya Baladigan. Patient should be shown. Hina Staulya Baladigan. Such condition, there is no need to do Pajana Dipana even. Shutrishna Nigraha is enough. So such a kind of demarcation, and whether Langhana is needed or Brahmana, also Acharya says very specifically, Na Brahmed Langhaniyan, Langhyamstu Mridu. Sorry, Brahmyastu Mridu Langhayet. Yuktya va Desha Kaladi Belatastan Upachare. You have to consider Desha, Kala, Bela, everything to decide whether Brahmana or Langhana is done. That is one thing. Now, nowadays it is considered that stula patient is coming, dyslipidemia is there, Shodhana, like that, Shodhana is decided, Panchakarma is decided. How it is possible? Staulya is happening by from Ahara, Kabha Vardaga Ahara. That is why Acharya told very specifically, Gurvadi Vruddha Samlina, Sleshma Misla Annajo Rasa. Amameva Shradi Kurvan Dhadun Staulyam Upaneye. So it is originating from Kabha Vruddhigara Ahara only. Gurvadi Vruddha Samlina Sleshma Misra Annajo Rasa. Annarasa is getting mixed with Sleshma. Amameva Shradi Kurvan Dhadun Staulyam Upaneye. So there can be Kabha Vruddhi and Medo Vruddhi. It can obstruct Vayu. Meda Kabha Vruddha Vayu can happen. So in such condition, Avarana can happen, Ama can happen. All these conditions are not intended for Shodhana. There are different specific principles, treatment principles. We know that in Ama condition, Bhalad Amad Rasaniva, you should not be doing Shodhana there. So it is very dangerous to do Shodhana in Ama condition. And in Avarana condition also, Meda Kabhabhyam Anilo Niruddha Shulanga Sukti Shwayadum Karodi. There also, if Snehana is done, Abhudastu Tasmai, when a person who is ignorant is doing Shodhana, what will happen? Samvardhayati eva Ashuvikaran. It can cause emergencies also, medical calamities also, if samshodhana is done. So there is no general rule that all these conditions which are intended for langhana in general are intended for shodhana. Nowadays it is misled like that. Those conditions which are intended for langhana is to be managed by shodhana. It is not like that. Only samshodhana is taulya, bala, pitta, kabhadigan are intended strictly for shodhana. And Acharya also told in Kabhavrta Vada, yes, yet syad kabha prashamanam nacham ayurveda kobanam. So that treatment principle is to be adopted there. And matradi yukta seveda yastu brahmana langhanehi sama dhatogni dosha asau sama samhanano bhavet. So it is very important to consider the matra and yukti to decide whether brahmana or langhana is to be done. So this is my point. Generally, samshodhana, strict indications in patient is to be demonstrated. This is what theory I am telling. But I can demonstrate in patients what kind of patient is this. Whether he is intended for langana, what kind of langana is intended in that patient, how and why. That is to be demonstrated and explained to the students. That is what a Panchakarma faculty is intended to do. Not deciding Panchakarma package in the beginning itself. And it is not desirable to do Panchakarma package in the beginning, for which I'll give you certain evidences in the later sessions. Thank you.
This is very clear. Acharyas have clearly told that Roga Madho Pariksheda. Roga Madho Pariksheda means you have to examine with Shastra Arthas, understand the Shastra, then apply how we can apply it practically. That we have to assess first. Assess, analyze, and estimate. What is the disease status? What is the strength of the disease? What is the patient status? What is the strength of the patient? So, state and stage of Roga and Rogi are to be estimated. Then we have to check for Roga Madho Pariksheta Tado Anandaram Aushadam. So, Aushadam or treatment principle has to be assessed and estimated. Then which all medicines could be used, that also has to be assessed and estimated. Tada Karma Bhishak Paschat. So, its application is to be done last. It is not the disease or the patient that determines which Shodhana Chikitsa is to be done. So, Tada Karma Bhishak Paschat is the treatment principle how to adopt in this patient. So, Shodhana itself, it's mentioned as 5 types of procedures are mentioned as Panchakarma. Shodhana is moving out of dosha from the body is Shodhana. So there are several other methods also. Like if Srota Shodhana is done also, doshas automatically move out. If Pachana Anulomana is done also, doshas automatically move out. If a Sneha Samyak Yoga happens, Padan Lomyam Diptu Apnir Varchas Niktam Asamhadam, doshas will move out and homeostasis will be maintained. And Doshapaharini Matra is also there in Sneha. So you need not go for a procedure. Swayam Pravritam Tam Dosham Upeksheda Hitashinaha. In Adhisara, so dosha when it is moving out naturally, you just need to support with Hitashinaha. Take Hita foods only. So Shodhana is expulsion of doshas. So doshas when are being expelled by some other means, that is Shodhana itself. It is not like we have to do Vamana, Virejana, Basti, Rakta Moksha itself, etc. itself to do removal of doshas. So finally, I am not telling that these diseases are Shodhana are to be done compulsorily. We have to assess Roga, Rogi first. Roga, Rogi, state and stage first. Whether Samhanna is there, whether Bala is there, whether Prakriti is favorable for this procedure or whatever be it, we have to examine the patient and determine the strength of the patient stage of the patient, stage of the disease, strength of the disease. Then we have to analyze the treatment principle and what all dravyas are to be incorporated and how to incorporate. So this is a big process. It's a long process. Rogamadu Parikshada Acharya have said it very simply and to the point. Rogamadu Pariksheda Tado Anandara Aushadam. Aushadam has to be Pariksheda. Tada Karma Pishak Paschat. Jnana Purvam. Jnana Purvam means it should be based on science. So scientifically, everything has to be done. Pariksha, assessment, analysis, estimation, implementation. Everything should be done based on science. Yeah.
I would like to add there, avastha of the patient accordingly, acharyas have told, durbalo bahudoshasya dosha pagena yas swayam virichyade bhedaniyer bhojistam ubajare. There, no need to do virechana. You need to do bhedana bhojya only, not even medicine. Where in durbala bahudoshatva is there and dosha paga is happening naturally, they are bhedaniya aushadas. Also, another context, durbala shodhida purvam alpa dosha krisho nara aparijnada koshtasya piben mriddu alpa bheshajam. If you are not sure of the status of the koshta, he is durbala. Already shodhana has been done one time. Pur alpa dosha krisha. In such condition, what you have to do? If you are not sure of the koshta, pipin mriddu alpa bheshajam. And last but not the least, it is also mentioned, Hare bahushalan doshan, alpan puna puna, durbalasya mridu drave, alpan samshame tutan. So, bahu dosha is there, but it has to be removed slowly. Alpan puna puna, again and again, in the case of durbala, by mridu dravyas. And still, if it is very low quantity of dosha, samshamana can be adopted. So these are the golden rules of determining how, what, when, where in a particular patient, even if shodhana is intended. So considering the bela of the rogi and doshas. So all these are to be educated in the patient, demonstrated in the patient.
Thank you, ma'am. Thank you,
Thank
sir.
you, ma'am.
Next question.
Ma'am, next question is why mentioning of Shodhana word before Shamana in Maximum Sutra? Panchakarma in every disease. Does it means we have to do first Shodhana then Shamana? So Shodhana word mentioned everywhere in Samhita. Is it referred to Panchakarma or not?
So this Shodhanam Shamanam Chedi Samasad Aushadam Vidha. So treatment is broadly classified into Shodhana and Shamana. So in all diseases, evam anyanapicha vyathin swa nidana viparyat chigilse. It is mentioned in Sutrasthana. We have to address the basic cause first. Then only we need to think of the disease. In certain diseases, we may need to think of Hetu and Vyati Viparita together. So in such conditions, if Shodhana is required, Tadascha Sthana Visheshena Peshaja Visheshaha Patyeshitavyaha. So based on the Sthana, we have to search for Peshaja. So Vadik, one disease or Kapha, one disease. So same medicines which are to be used in some other disease condition cannot be used because there are specific indications for those herbs also. Those medicines also have indications. So which act on that sthana could be utilized for Shodhana Chikitsa. So science is complete. So all the aspects are explained in the science. In this condition, if Shodhana is required, how to use that Shodhana, how to implement Shamana methods in this disease. Actually, we can implement all those methods from the basic things itself, like Eva Manyana Picha Vyathin, so Nidana Vipadya, Dosho Upakrama, everything is mentioned. But we cannot adopt when Hetu Vyati Viparita is required. That's why Shodhana and Shamana methods, which are the basic classification of treatment, is explained in all diseases. But in the present day, the indications require, we need to assess the dosha, bahudosha lakshanas. Before that, we need to assess the hetus, whether the same hetus are causing this dosha dushti or dosha dushti is secondary to something. So if sama dosha means ama is developed, ama means untransformed rasadhatu is developing. Because of this untransformed rasadhatu, the dosha kopa is happening. So when Tridosha Kopa is secondary to Samadosha, Samatva, when we address the Samatva itself, Tridosha subsides automatically when Ama gets subsided. So that is the point. So if Visha, toxic metabolites are developing in the body, Atyachana, which is happening now, people are taking 5 times food or 6 times food along with Chavanaprasha and other rasayanas. So it is Atyachana is happening. Virutha Atyachana Ajirana Shilino. Virutha. Virutha is Guru Shita Atiruksha Bhojana. So there is ketone diet, or they will be having fruits only diet. They will be skipping meals, or they will be taking unwholesome food. So all these are Virutha. So Virutha, Atyashana, etc. will be producing toxic metabolites in the body. These toxic metabolites can produce dosha dushti. So in such conditions, we need not address dosha dushti first, or we need not go directly for shodhana or samana, or if bahudosha lakshanas are seen, then also we need not go for dosha shodhana or other treatments, because it is secondary to this toxic metabolites or visha. Visha happening in Rasadhadu, visha happening in Raktadhadu, all these can cause dosha dushti. Dosha we can assess by lakshanas itself. If all the symptoms of a disease, if Vatika Adhisara, all the lakshanas of Vatika Adhisara are present and in a severe form continuously, then it is considered as Bahudosha. Any disease with all the symptoms manifesting in severe form continuously is to be considered as Bahudosha. But Bahudosha, whether it is primary or secondary, that we have to assess. As Bahudosha lakshanas are seen, or Kushta is manifesting. Kushta can be allergic, Kushta can be autoimmune induced. So, without assessing the Nidana, evam anyanapich vyathin, so Nidana vipadhyat chigilse. So, Nidana is autoimmune condition, altered immune status. Because of this altered immune status, through dosha gopa is happening or dosha gopa is happening. And if all the symptoms are present in a severe form continuously also, you need not do shodhana chikitsa. And if utklishta lakshanas are seen, there are methods mentioned in Chadri or Atisara with which we can remove the in natural way itself. So we need not just check the dosha lakshanas, and kushta is a bahudosha condition, so we need to do. Or prameha is a bahudosha condition. Adhistaudya is a PCOD, is an adhistaudya condition, so we need to do shodhana. That is completely wrong. Acharya has said that na shastra matra sharano, na cha analuchit agama. So shastra is just light only. So we have to see with our buddhi. Shastram jyoti prakashartham darshanam buddhi atmanaha. So Shastra gives light. So it gives so many nirdeshas, adeshas, so contraindications, indications, etc. are mentioned. Whatever this situation necessitates, that we have to find out with our buddhi, apply our tattvas, apply the tattvas mentioned in the science, and we need to develop pratipatti jnana. So everything is buddhi related. Shastrartha jnana, application of tattvas, or prayojanam, practical utility, we have to assess in the diagnosis as well as in the treatment, and finally we have to reach the pratipatti. So it's not like bahudosha lakshanas are seen, or this disease needs shodhana chikitsa. And which type of shodhana I have explained before also, like srodha shodhana could be done, pajana deepana could be done, pajana anulomana could be done. So all these are removal of doshas itself. So don't depend on Shastra alone, or without Shastra, don't do anything also. Na Shastra matra sharano, na cha analochita agamaha. That's it.
There is a very interesting shloka. Actually, the problem is that applied level of teaching is not happening. That is why all these confusions are. That is one thing. Second thing, we have to update our application of science in accordance to the contemporary requirements. How the modern age patients are. Whether patient is intended for Shodhana is not what is to be examined. See, to solve a problem, the problem requires to be studied first, not the Bheshaja. First of all, the problem and the patient needs to be studied. He's a modern age patient, means he will be on 5 to 10 medications for different problems. Agni Dushti, Ojo Dushti, Sroto Dushti. So many suppressants, blocking, masking, etc. will be going on. And we don't know exactly what the side effects of these medications have impacted in that patient. So first we have to understand and treat. And apart from that, a new Samprapti has developed for which he has approached you for treatment. So what is to be done is Desha Kala Pramananam Satmya Asatmyasya Evacha Samyak Yogo Anyadha Yesham Patyam Abhi Anyadha Bhave. So Desha, Kala, Pramana, Satmya, Asatmya, all these are to be checked in the patient. And Kala refers to what? Dina, Adura, Aushada, Vyadhi, Jirna, Linga, Ritu Avekshani. All these refers to Kala. Dina, which part of the day? Then Aushada Kala, Vyadhi Avastha, Jirna, Ahara Jirna and Aushada Jirna Lakshanas are to be examined. And also Ritu, seasonal impact. All these are to be examined. And coming to the topic, you were telling that Shodhana is intended first. But I was just checking all diseases in general. But in the context of Jwara, where Virechana is advised, Kriya, it is mentioned Kriyabhirabi Prashamam, Na Prayadi Yada Jwara, Akshina Belamam Sagne Shametam Virechana. It is mentioned that Baki rest of all the procedures, Jwara is not subsiding by Shamana measures. Jwara is not subsiding by Shamana measures, and Akshina Belamamsa Agni. If the patient is having Akshina Belamamsa Agni, in such conditions, Nirama dosha status, you can think of, in Prabodha dosha status, you can think of doing Virechana. And also where Vasti is intended. Actually, that Samsana and Vasti are mentioned in Jwara. Pittam va, Kabha Pittam va, Pittashe Gadam Harek Samsana. So from Pittashaya, Kabha and Pitta or Pittam alone is removed by Samsana. But at the same time, Tridoshas in Pakvashaya. So that is to be removed by Vasti. So there are very specific indications when to do Vasti in Jwara. And also Anuvasana, we know Jware Purane Samshine, Kabhapitte Gridakne, Ruksha Pradadyat Anuvasanam. So that is mentioned. And also Jwarebhyo Bahudeoshebhya, Urdham Chadasya Buddhiman, Dadyat Samshodhanam Kale. Acharya told very specifically, Bahudoshebhyo, Urdhvam cha adasya buddhiman, Dadyat samshodhanam kale. Kala refers to all these aspects. Dina, Adura, Vyadhi, Jirna, Ritu, all this. And in coming to Rektapitta, Langhanam Rektapitta adau Tarpanam cha prayojayet. Where is Shodhana mentioned in Rektapitta in the initial stage? Langhanam Rektapitta adau Tarpanam cha prayoje. That is what is mentioned. In Prameha, what is mentioned? Stula Pramehi Balavani Hega, Krishasta Dego Durbalasha. Some Brahmanam Tatra Krishasya Karyam, some Shodhanam Dosha Baladigasya. Again, there are many Shamana methods mentioned. And in Kushta, what is told? Kushta Vishesher Dosha, Dosha Vishesher, Punasya Kushtani. And also the treatment principle in Charaka for Kushta begins like this. Doshasya yasya pashyet kushteshu vishesha lingam udriktam taseva shamam kuryat param cha anubandhasya. So which all doshas are considered as most vitiated? Shamana should be done considering anubandha doshas also. बहुदोष संशोध्य कुष्ठी, bahusho anurakshada pranan. Whenever there is bahudosha lakshanas, only think of doing kushta, I mean shodhana karmas in kushta rogi. Again, what he told just now matters. Kushta, nowadays ayurveda doctors are unable to differentiate whether it is skin disease or whether it is swadandra roga or paradandra roga. It can be not skin disease by visha, it can be by infection. So first of all, demarcation should be done. Hetu is to be analyzed. Tasmat vigara pragriti adhisthana andaranicha. Samuthana visheshamsha buddhva karma majari. All these are to be known, whether it is happened by ama or ama visha or dushi visha or agandu visha, or it happened by some what you call direct poisoning. So all these matters, and against dosha, against cause, we have to treat. So that is very important. And in kushta again it is mentioned doshe hriday abanide rekte bahya andere hriday shamane snehe cha kale yukte kushtam anivartade sadhyam. So adivartade sadhyam. So it is mentioned that shamana and snehapana is mentioned for preventing the remission. So Shamana Snehapana can be done as Shamana Snehapana also, not always as Purva Karma. And all these methods, it is not like Shodhana is mentioned first. We want to see Panchakarma, so we are looking for Shodhana. That is all. But everything is mentioned in every chapter. Only thing I gave some examples just to make you understand that you should not be reading a book with predetermined mindset. You should be exploring that. You should be exploring that context properly in the patient. So, Ajnada Shastra Sadbhavan Shastra Matra Parayana Teje Dura Bishak Pashan Pashan Vayoswadaniva. If you do not know Shastra Sadbhava or Shastra Artha and you are merely reading text, generally they will see only Panchakarma and Shodhana, but we should be understanding Shastra Arthas and apply that correctly in the patients. That's all.
One more point. In Jwara also, Nivartopi Jware, Yathavastam, Yathabalam, Yatha Pranam, Hare Dosham. So it is Dosha Harana is mentioned. But next phrase is Prayoger Va Shamam Nayet. So you can do either Shodhana or Shamana according to Avastha, according to Bala, according to Prana. So according to homeostasis, Samhanana, everything we have to check and finally decide. So present day, it is not the disease that is important. In the science itself, it is mentioned that it is not the disease that is important. The cause of the disease is more important. So you have to check for Atyashana, Viruthashana, or Vishamasana. All these can cause Agni Dushti, Ojo Dushti, Sama Dosha. So we need to assess the Hetu first, and on reversing this Hetu, dosha, whether it's Bahudosha or Alpa dosha, it gets subsided automatically. And Bahudosha, how to assess? The question you have to assess by the continuous persistence of all the symptoms mentioned in that disease. That is the Bahudosha Lakshana. And not only Bahudosha Lakshana, Utklishta Lakshanas are to be seen for producing or for application of this Vamana or Virechana.
As ma'am, as you were telling about Kushta, so in few diseases like Chikitsa mentioned as Pakshe Pakshe Vamanam Mase Mase Virechanam, etc. So how to interpret that shloka?
So just now I told cause is different, isn't it? If you are getting an eczema, you need not do doshe hriday, apanide rakte, rakta moksha need not be done. It is just an allergy, altered immune response. For Ojo Dushti, the treatment principle is not like Tyaga Vishama Heduna, Samanam Chopasevanam, Jayante Thadava Sama. So there no need of any Shodhana Chilsa, no. Tyaga Vishama Heduna, Samana Upasevana. So Vishmana Anupathanti Jayante Thadava Sama. So there is no, means when you are normalizing the dhadus, ojas automatically becomes normal. So there shodhana is not required. When Visha is causing, there Visha Shamana treatment is to be done. When Ama is causing, Ama treatment is to be done. When autoimmunity is causing, we need to address autoimmunity only. So dosha, the secondary dosha dushti automatically gets subsided. So there are autoimmune skin diseases, infective skin diseases, allergic skin diseases. So all these skin diseases need not be, dosha harana need not be done. And dosha harana is always not panchakarmas. That's all.
Actually, science-based, evidence-based Ayurveda is to emerge. Then students will get exact knowledge regarding all these points, what we are telling. We need to have a very big, deep level orientation program for faculties, not only for Panchakarma faculties, faculties of all disciplines should be undergoing science-based, evidence-based Ayurveda is not two people's private property. It is a method emerged from the science to understand science and apply science correctly. And we have done so much of hard work in science to emerge that technique. It may have flaws, but to understand flaws, again, that technique we have been applying from right from 2012, from the year of 2012. And it is not that two things are making a method scientific. One is transparency, second is repeatability. So both are happening from 2012. We are able to explain what these techniques are, how they are to be incorporated in modern age diseases, and what will be the results. We can demonstrate. And the patients, the learners can themselves understand. They can apply the same logics. They can apply in patients, and they can evaluate that. So there is a standardized objective method. It is not Remya's method or Rajkumar's method. It is scientific method, inbuilt science-based, evidence-based method. What is intended in the science? That through us, it emerged. We are only a nimitta karana. Actually, we don't want to claim that SBB is our private property. If it is our private property, we could have sold it and earned money instead of doing all these things, trying to make a change. So we understand that this emerged only for deep level standardization, and this emerged only by the blessings of true legends like Vaidyabhushanam, Raghavan Tirmalpat sir. It was his dream to make Ayurveda treatment at most scientific and at most on the target, and mainstream medicine with most minimum medication, intended effects, fast and intended effects. So I feel that with the incorporation of SBBA in curriculum, things will change. There will be a very drastic change in the impact of patients. Ayurveda will not be as it is today. Conventional Ayurveda, like I know, you both are well aware of what I'm speaking about. For the sake of audience, I'm speaking. Yeah. Thanks.
Yes, ma'am. Thank you, ma'am.
Thank you, ma'am. Thank you, sir. I guess my next question you have already answered. What are the exact condition to do in Panchakarma? What all the exact cases or conditions? So we move to next question. What is your view on Ritu Shodhan, Keraliya Panchkarma and Karkata therapy?
Vasanta Shodhan. Okay. In Ritu Chedya, everything is based on Ritu. What is being explained is based on Ritu. So in Ritu, how doshas are getting aggravated is explained that there are two Viryas, Ushna and Shita, and food and regimen, which are having certain gunas developed in the food and water that we consume. So when that Ushna Virya combines with these gunas, or Shita Virya combines with these gunas, which enter our body through food and regimen. Ushnena Yukta Rukshadya, Vayoho Kurvanti Sanjaya. So Vayu Sanjaya happens in Ushna Ritu or Grishma Ritu when there is Ushna Virya. Food and water will be having these gunas, like Rukshadi gunas will develop. And when this Ushna Virya plus Rukshadi gunas will cause Vadachaya. And in the next Ritu, when it becomes Shita, in Varsha Ritu, when it becomes Shita, so that Virya determines whether that transformation has to take place or not. And also, the Sharira also determines. In my Sharira, whether Vata should undergo Prakopa or Chaya or whether I should remain healthy is determined by so many factors like Prakriti, Sara, Samharana, Sattva, Satmya, Ahara Shakti, Vyayama Shakti, etc. determine my Vyayama Snikta Deeptakni Vayasta Benashalina. So, based on all these factors, whether doshas should develop in my body or not is also determined. So, based on Ritu, this dosha is to develop, and based on my body status, whether that dosha will develop or not is determined. So, in the first case, Ritu is not that much hot in Kerala. So, Virya is less. Ushna Virya is less. So, dosha chaya may not happen. And also, we are consuming food not from my place, it's coming from Tamil Nadu and other places. So, food and water will not be having the qualities which is mentioned in the science. So, both these things are not there. Grishma Ritu, Ushna, Virya is not there, and Ahara and Jala are not having these qualities which is mentioned. So, Vada Chaya happening in Grishma Ritu is very less. But Varsha Ritu in Kerala, people consider it as Ritu in which Vata Prakopa will happen. But as there was no Vata Chaya, chances of Vata Prakopa is also less. But people think that in the olden times, there was a tradition that Karkadaga is a month after Varsha Ritu, but it's heavy rain in Kerala. So in Varsha Ritu, during these extreme seasons like Varsha, Sharad, Vasanta, Shodhana need not be done, should not be done. Or if in emergency only, you can do such treatments. But in Kerala, there is a practice that in Karkadaga month, when rain is heavy, people used to practice so many medicines which are being traditionally passed from generation to generation. Without thinking of science, earlier it might have been in scientific manner, but now it is blindly followed that everybody should take this, everybody should take one rice gruel or so many cereals, mixed gruel should be taken along with so many herbs added blindly without any justification. So that is being practiced to subside Vata and to improve Agni, and many do Keraliya Panchakarma, means so many snehas where the techniques are there. So those who are having Meda Kapavarta Vada, earlier Dr. Ramya told, Sneham Niyujyan Abhutastu Tasmai Samvarthet Yevahi Tan Vikaran. So all those Vikaras can increase. Most of the patients are having metabolic syndrome, and when they take this Sneha Sweda treatment, Sneha is contraindicated in such conditions, but in Karkadaga month, in monsoon season, they will be blindly taking all this treatment, and within 1 or 2 months, they may develop heart attack or stroke, or they may develop some other critical conditions. So, but they will be thinking that it is not due to this treatment, it might be due to some other reason. So, all these things mentioned in science is from the perspective of Ritu, not from the perspective of the patient. When we are treating a patient, we need to consider the patient only. Whether dosha kopa has happened in that patient or not, we have to assess in the patient. So, Vasanta Ritu doesn't mean that all will be having kapha prakopa. So, my disease status will be different, my body status will be different, my samhana will be different. I may not be prone to kapha aggravation. So, but people think that Vasanta Ritu is kapha predominant or kapha prakopa will definitely happen. Apatyahara dosha sharira visheshekyo. So, Vyadhevo, Mridavo, Daruna, etc. will happen. Apatyahara always will not produce. All cigarette smokers are not getting lung cancer. All alcoholic people are not having liver disease. So that apatyahara will have a threshold in his body. he can sustain this much toxin in his body. So after that only dosha dushti happens. He has habituated alcohol, so it will not produce immediate effects in him. So it will be causing after a period, or when his samadosha status is affected, dosha dushti happens. Then also vyadhi utpadaka pratibandhakatvam will be acting. And finally, when Srodho Dushti happens, disease develops. So, apatyahara dosha sharira visheshekyo. Vyadhi develops or not. So, giving vasandik vamana, irrespective of their status, uh, everybody is given vamana. And their previous morbid status, their strength, what all complications can develop. All these things are not at all considered, and blindly giving vamana is very dangerous and it can turn fatal also. In Kerala, this Karkadaga treatment, Keraliya Panchakarma, in the name of Keraliya Panchakarma, externally as well as internally, medicines are having virya. Virya means it will definitely produce a change in his body. If it is in a disease status, it will try to reverse it if it is accurate or perfectly applied. If it is in a healthy status, if you are giving wrong treatment, Gadadichara is major cause of diseases in the modern era. So that also causes Agni Dushti, Ojo Dushti, and it can affect Pranasraya Tanihi Pidendu, Vadadev Asunapi Pidendi. It can definitely result in fatality. So this Keraliya Panchakarma, in the name of Keraliya Panchakarma, 5 processes is named as Panchakarma. It is not Dravya Guna Karma. Kartavyasya Kriya Karma is based on its gunas. The action which the Dravya performs is karma. But this karma is name given to a procedure only. So a science should not be based on 5 procedures. Procedures have to be done by technicians. Procedure, whether it is needed or not, how to implement, etc., have to be determined by the Hishak. So Vasandik Vamana and Keraliya Panchakarma in Karkadaga Chikitsa, etc., are highly unscientific. Highly. It is very much dangerous and it is distorting the science and it is causing so much blemish in Ayurvedic science popularity.
Actually, this is one reason why Ayurveda is converted as spa therapy, because of over emphasis given to various kriya kramas. Baladishtanam arogyam arogyartham kriya krama. Everybody is forgetting what is the objective of treatment. It is for making health in the patient. That everybody is making money in the patient, making money from the patient is the objective now from Ayurveda. That's why this kind of distortion is happening. Just I want to tell a reference here. Yes to rogam avijnaya कर्मण्य आरभते बिषक अभि औषध विधानज्ञ तस्य सिद्धिर यदृच्छया. Even when he is an excellent person who is aware of all the treatment upakramas and principles, if he is not knowing roga, how to diagnose roga and rogi, then siddhi is yadricha siddhi. It is you cannot justify it as scientific cure, and also it is just spontaneous cure only. So yastu roga visheshatnya sarva bhaishajya kovidah desha kala pramanatnya tasya siddhir asamshya. So that is the most important. Yastu roga visheshatnya. Visheshatnyana should be there. He is called specialist. BAMS doctor is meant to be a specialist of human body, not panchakarma. Even BAMS doctor. Yastu roga visheshatnya sarva bhaishajya kovidah. And not only that, desha kala pramanatnya tasya siddhi rasamshya. Only that person is deserves to be called as bishop. Otherwise, others can be called as quacks only.
Thank you, ma'am. Thank you, sir. Sir, our next question is elaborated well in previous question, but I'm repeating that. If you want to add some points, then please add. The question is, by Shramana, dosha pacify, and by Shodhana, removal of dosha. Does that mean Shodhan is superior to Shamana.
So that shloka, which is told that dosha kadachit kupayanti jitaha langhana pachane jitaha sanshodhane na tesham punar udbhava. Mic is mute, sir.
सर आपका माइक म्यूट हो चुका है.
Yeah. Final objective of treatment is to be dosha free. So if you do shodhana or if you do shamana, finally you should be dosha free. Disease causing dosha free. It's not the doshas which maintain the homeostasis. So Agni, Vayu, and Panchakapas are responsible for the homeostasis, but the disease causing dosha, if it is not there, then there is no chance of developing a disease. So whether you do shodhana or whether you do shamana. And the more important thing is prayoga shamayat vyati yo anyam na udirye. So one treatment should not cause dysfunction of any of these homeostasis. When you are doing shodhana, you are removing the dosha, you are trying to remove the dosha, but along with that, the homeostasis is disturbed. Agni is disturbed, Vayu is getting disturbed. Its homeostatic mechanisms are getting disturbed, and it can be brought back after this Peyadikrama or Tarpanadikrama. So you are causing so much exertion to the patient, and you are trying to bring back. More effective method is this Saptavidha Shamana, Pajanam Deepanam, Shutra Dhyayama Atapa Maruta. So Pachana, Srota Shodhana. So by Pachana and Deepana, Srota Shodhana happens. Dosha Yandi Tatha Depya Srodo Mukha Vishodhanat, Vrutyapishyandanat, Pakat, Koshtam Vayosya Nigraha. So we are uh, uh, we are friendly with the body when we are doing Shamana. So maintaining the homeostasis, doshas are brought to Koshta, and in Koshta, it could be further metabolized. It could be reaching Amasya or Pachimanasya or Pakvasya, where it can be metabolized by Jadharakni itself. Or it will be moving out through its natural orifices when you are practicing Hitasana. And also Vyayama, Kaphe Prachardhanam, Pitte Virego, Vastir Irane. So the treatment principle for Kapha is Vamana, Pitta is Vireka, and Basti for Irana, Vayu, Vata. Shasyade Trishru Abhi, superior to all these three. Sada Vyayamo Dosha Nasana. So there it is mentioned that Vyayama is Dosha Nasana, Sarva Dosha Nasana. All doshas can be mitigated or metabolized by Vyayama. So which one is better, whether Vyayama or Shodhana? The method adopted by Acharyas. Yeah. Method adopted by Acharyas is in respective chapters, it will be given more importance. When Shodhana is explained, Shodhana will be given more importance. When Basti is explained, it is explained as Artha Chikitsa. Right. So we need not do any other treatment. Only Basti is to be done. It is not like that. To show the importance, to show the significance, Acharyas will be giving some extra importance to that. So, in that context, Shodhana, importance of Shodhana is mentioned. But finally, the objective is Pratyaksha Phala Darshanat, whatever you are doing, that will be justified, right? So, Pratyaksha Phala Darshana, Phala, what is intended is removal of dosha from the body and to maintain homeostasis. Homeostasis can be maintained by normalizing Agni and Vayu. Vayu will be producing dosha dhatu Agni samadha, samprapti visheshucha, kriyana manilopyamcha, karoti akupido anilaha. So the homeostasis is maintained by Vayu through Agni. So Vayu and Agni will be maintaining homeostasis. So that is attained only by Shamana. When you are doing Shodhana, you are disturbing the whole Vayu and Agni activities. which can disturb homeostasis, and thus we can justify that Samana is far, far superior than Shodhana. And the present day diseases, Dosha Prakopa and Bahudosha are secondary to Agni Dushti, Ojo Dushti, or Sama Dosha. So, Sama condition, all these are causing um, Dosha Dushti as well as Bahudosha Lakshanas are produced. So, in this present situation, Shamana is the best method, that too with Sneha, that too with Krida. Nahi Sneha Samithasya, Shamaya Annam Sukurvapi. So, Agni will be maximum with Shamana treatment. After ghee treatment, Padan Lomyam Deepto Agni, Varchas Niktam Asamhadam. When Agni is maximum and Vayu is in perfect state, that state is termed as purified state of the body. It is not like removal of dosha is not the purified state. Purified means the dosha is devoid of any sort of discomfort or any sort of pathology. So causative dosha, if removed also, Agni and Vayu are determining the homeostasis, which is maximum augmented by Shamana treatment. Best method is Vyayama. Vyayama, according to age, everybody can practice. And that is the best method in the present day to maintain homeostasis. And also, Viritha will be countered by this Vyayama also. Vyayama Snikta Diptakni, Virotya Vinna Pidaya. Yeah.
Thank you, sir.
Thank you, sir.
My next question is यथा कर्मम यथा योगम अतः ऊर्ध्वं प्रयोजयेत रसायनी सिद्ध्यानि which योगस्य कालविद. Shodhana is needed for rasayan sevan or not?
Rasayana and Vajikarna is done on Swastha, right?
Yeah.
So Swastha, once it is attained, and Shodhana Chikitsa is intended to remove pathologic dosha. If pathologic dosha is not there, if you are doing Shodhana, it will be affecting the homeostasis and it will be disturbing the whole thing. So, when you are doing Shamana treatment itself, Samadosha, Samadhadu, Samagni will be attained, and at that stage, Rasayanani are to be done. Rasayanani means the normalizing the srotas of rasa. So, clearing this channels of rasa will automatically cause rasayana, and if you are giving any rasayana medicine also, it should be according to the digestive power, metabolic power, ahara shakti, etc. So, this pancha karma is just 5 karma only, procedures only, and it's not a mandatory thing to be done before all rasayana or vajikarna treatments. So whenever you are healthy, to improve your health status, rasayana and vajikarna are done. It is not to disturb your homeostasis.
I would
So it's
like
not mandatory or it's not at all needed.
I would like to add a point there. Shamana Snehapana, as we do in SBBA, Shamana Snehapana has got immense potential in Rasayana, in creating the Rasayana impact. As we know, Ditandara Agni Parishuddha Koshta Pratyagra Dhadur Balavarna Yukta Dridendriyo Manda Jara Shadayu Snehoba Sevi Purusha Pradishta. So when we are doing Snehapana in Shamana dose, that also Hriswa Matra Snehapana has got immense potential in Rasayana, in creating Rasayana. Hriswa Peya Sugha Sahi Parihare Anuvartade Chiracha Balya Naruja Vyavan Nabi Pragalpade. So it is devoid of causing any complications. At the same time, it can alleviate diseases and it has got Rasayana effect also. But everything depends on where Sneha, Ada Urdhum Kabhe Mande, Vada Vittotare Jere, Paripakveshu Dosheshu. Sarparpanam Yadhamurdam. So when you are doing Snehapana as Shamana also, all these criteria should be fulfilled. And every Kriyakrama is to be decided based on 3 factors: Kala, Upaya and Artha. Kala means, as I already explained, Upaya is Yukti and Artha refers to the Upakrama Artha. That is Arthamidi Prayojanam. utility of dravya is decided by Bheshaja karma, Doshatna karma, and Rogagna karma. So that Upakrama is which Doshatna karma, which Rogagna karma, and which karma in general. That matters to Artha. So all these are to be considered while deciding the method to do Rasayana.
So as we are crossing the time limit, but I guess all the rest questions are just, extensions of all the funny things, I guess. So I'll just conclude and I'll ask one question like, that emergency managements are giving like, Agni Karma for pain or, Rakta Mokshan for skin disorder, hypertension, Siravedan, cupping therapy, like that, Sirodhara, everything Basti, like every patient have to be given like Basti or Sirodhara. It has been practicing like that only in OPD level. So for them, what you want to say?
Just one thing I want to say, whether Kala, Artha and Ubaya are befitting to this patient in this condition to do that procedure. That is the only thing to appraise. Kala, Artha, Ubaya, KAU. It has to be included in every Panchakarma record. I was searching for these three parameters, never found it in the record. Kala, Artha and Ubaya, if it is befitting to the patient and the situation, it can be done. Otherwise, there is no emergency condition specific Artha of Panchakarma in emergency condition. That's all.
Emergency conditions
Exactly.
also, yeah. Emergency conditions also developed by same pathogenesis. No? So one pathogenesis will be escalating to an emergency condition. In hypertension, it is not like one day immediately that hypertension manifests and patient is getting emergency. Hypertension, as it is hridaya activities are controlled by prana and circulation is done by Dashamula Sira Hristasta Sarvam Dasatmagam Vahan Yojaha. So Ojas, Dasa, Rekta, Ambu, everything is being circulated by Vyanavayu. So circulation is done by Vyanavayu and controlled by prana. So for this, why to do Rakta Moksha? So Rakta Moksha is not the solution and it can cause again Vada Vritti and again it can disturb the homeostasis and every time you cannot do Rakta Moksha. No? So it is not the method. If Rakta Moksha is done also, body will be making more blood by retaining water, more blood will be formed or in circulation more fluid will be reaching. So this is not the method to be followed like Rakta Moksha in hypertension or Kushta needs always Rakta Moksha because the causes are different. And Agni Karma done, it's a procedure that if it's needed, you can do to remove one surgical procedure. So always Tyaga Pratnabharadhanam Indriya Upashama Smritihi Desha Kala Atmavijnanam Satvartasya Anuvartanam. So here there is no Panchakarma or any other procedures mentioned. So this is the method. Anutpatyai Samasena Vitiresha Pradarshikaha Nija Agantu Vikarana Utpannanam Cha Shande. For all this, Tyaga Pratnabharadhanam Indriya Upashama Desha Kala Atmavijnanam Satvartasya Anuvartanam. Only these are the principles to be followed to remain healthy or to get rid of diseases. Yeah.
Also that there is one question, like giving jalebi and medu vada before Vaman, one night before. It itself like for kapha utkleshit, but it itself is a kapha dushtija nidana. So like why we are giving them?
So in disease status, you need not do Utklesha because doshas when brought to Koshta, when it is in Utkrishta Avastha, it will automatically get removed. But in Swastha, if you are doing, we have to make it Utkrishta. And better than that, so for making Utklesha in Swastha, but it is practiced in patients. But to make Utklesha in Swastha patients is this Sniktha Ushna Dravyas are being given, like Masha. So that is not needed also, and doing that in patients is totally unscientific, because their disease status will aggravate, because after getting digested, this is being removed. Means Vamana is being given or Videsana is being given. So once this Masha etc. gets digested properly, it will aggravate the disease. So such things are not to be practiced.
Thank you, sir. Thank you, ma'am. So, I would like to just conclude what you have told in this Panchakarma session. So, like what in starting we have discussed so many questions, and you have almost answered all the questions which we are having. So, in conclusion, I was just writing all those things that you told that Shodhanam Shamanam Cheti Samasas Aushadam Vidha, either expel the dosha or neutralize or counter the dosha. Like in any way, treatment is addressing the increased dosha. So in both the cases, the body will be without dosha. So Shodhana and Shamana are equally important, but it has to be applied according to the state and stage of the patient. And it is not like whenever Shodhana is mentioned, you have to do Shodhana in that respective disease. Right, Anurag?
Uh, yes, ma'am. And the chain lifestyle people are practicing adhesion and so many wrong things nowadays. And hence diseases are mostly due to the Sama dosha, Am Vish, and Dushi Vish, and sometimes Udavat also. So those aggravation is secondary to many other conditions. And like Agni Dushti, Ojo Dushti, and Am Ras Dhatu. So when we address the basic cause, it will get automatically subsided, this dose aggravation. And dose aggravation is secondary to some other pathology. So Bahu dosha develop also, and it's secondary, and it is also secondary to the other pathology. If at all required, it can be done in one method. Also, when doing Snehapan, Shrotoshodhana, not Snehapan, it's Shrotoshodhana, and its a slok is also there. Dosha yanti तथा तेभ्यो श्रोतोमुख विशोधनात्. So those should move out by Shrotomukh Vishodhan or Pachan, Anloman, or even by Snepan also. And
Also, that you have told that more than technical skills, Samyak Prayoga has to be taught in the college. And when the procedure are taught and practiced, we are giving more importance to the technical skills, and we are deviating from the science. So the focus has to be on procedure, but on it has to be on Samyak Prayoga. And treatment become like when we unnecessarily do treatment become costly, patient condition can get worsen, even sometime it become fatal also. And also, like finally, like Keraliya Panchakarma or Shodhaniya Panchakarma should be taught like other karmas and upkarmas only, and students should have practical knowledge, but still have to be developed by technical people only. And Panchakarma centers, other center which are focusing only on Panchakarma, they are highly unscientific. So thank you so much to ma'am and sir for enlightening our audience great knowledge on Panchakarma. Uh, for
With your permission,
Panchakarma.
I would like to conclude again by a very interesting sloka. Durgrihidam shinotyeva shastram shastram ivabudham. Sugrihidam tadevatnyam shastram shastram cha rekshati. Durgrihidam shinotyeva shastram shastram ivabudham. By ignorance, if you are mishandling, if you are not able to understand proper application of shastra and shastra, it can destroy you. Sugrihidam tadevatnyam shastram shastram cha rekshati. If you are able to understand shastra and arthas properly, that will protect you. Both weapon as well as science will protect you. That is what the conclusion for me.
Thank you,
yes,
ma'am.
ma'am.
Thank you,
Thank
sir.
you, ma'am. Thank
We'll
you,
see
sir.
in the next episode. Thank you.
Thank you, ma'am. Okay, ma'am.